So these two tables in the front.
Eli.
Alright, fellas, turn around here.
We got a good team.
Come on, let's get in here.
So instead of, we're gonna just go one category at a time, that way we're not like jumping back and forth so much from the, everything with the female reproductive system and the male reproductive system. So which group wants to go first for their question? Do what?
We have 5 people.
Yeah, we did.
Like 10.
But you'll have shade.
You count as 4 people. Alright, what do you wanna start with, Shay?
I guess that one. Or what, that one. What do y'all wanna do? So we can start.
You don't have to start at 100 if you wanna.
I think you win the vote because you're like 4 people, so you don't even have to ask anybody else in your group.
300, female 300.
Okay. Benign lesion in the pelvic cavity causes chronic pelvic pain and infertility. What is the name of this disease?
Oh, is this multiple choice?
Everybody multiple choice?
Or that
Yeah, you can use your book.
I was gonna say
real quick.
Yeah,
So don't, not gonna take forever.
Is that right?
Group 2 wants to answer.
Are we saying Paula? We just know.
She's the only one. Pass, Shay. You don't want this question passed.
Okay, here's 5 more.
Team 2 wants to answer.
We're next, they fell.
What is it?
Endometriosis.
Yes.
Oh,
Okay. The correct answer is endometriosis.
71.
I'm not ready to do this. What is endometriosis?
How did you know that it was endometriosis? Or did you?
My cousin had it.
Yes.
The only reason I know. I promise.
Well, considering we just had a 9 test, you know, we most definitely have all read this 10 child test. For sure. Is she gonna give us I asked you to give us.
Alright.
Okay, I need to, yeah, I need to take notes.
So endometriosis are benign lesions in the pelvic cavity. They cause lots of pain. A lot of times patients, females will come in, they'll just be complaining of a lot of lower abdominal pain. They may say it's very severe. Another thing that is really big with endometriosis is it can cause infertility. A lot of women may not even know that they have endometriosis until they're trying to get pregnant, and then they can't. So then the doctor is going to do more tests to find out why they're unable to get pregnant, and then that's when the patient may find out that she has endometriosis. Okay? Yes.
I thought endometriosis or whatever is when the uterine tissue grows outside of the uterus. Is that still what it is?
It's that too, but you're also they're gonna be benign lesions, so when they're gonna do the pap smear. So does everybody know what a pap smear is? Kind of. So how do they do it? Does anybody know how they do a pap smear?
They use the screen
That hurts. And then they take an isolation tip and go, ooh, it's
That's about it.
What position is the patient in?
Lithotomy or lithotomy.
Is it comfortable, uncomfortable?
It's uncomfortable.
So what are you gonna tell your patient?
To breathe and relax and know that it's uncomfortable.
Tell them what you're doing.
Okay, so they're gonna open up the cervix with a speculum. Has everybody everybody know what a speculum looks like?
Crazy.
Yeah, it kinda looks like duck lips, there's metal ones, there's plastic ones, there's all different sizes of speculums. So the doctor or the nurse practitioner will insert that, and then crank it open, and then swab the inside of, then they'll send this off, and that's how they'll determine what the lesions are, okay? So, cause if it's not a benign lesion, what are you gonna think it is? It's cancer, so. Alright, who wants to go?
Well, we can do like T1, or T1, I mean, I don't care.
Yeah.
Oh, region 1.
One, two. So number 3. Oh.
That's okay. Good Jessica. Good Jessica.
How about male?
Still talking all female.
Oh, we have to do female?
Yeah, just so we're not switching
Oh,
back and forth
okay.
so much and just,
Female
and
400.
notes will be all over the place.
There's 4 females in this group.
That doesn't mean
What is the biggest risk for females with using contraceptives?
One is blood clots.
Yeah, that should have been like a one.
Why?
No, it's called my triggers. That's not part of the question. I answer the question.
Well, why?
Hormones,
Yeah, that's-
the estrogen levels cause blood to clot.
Do all contraceptives have estrogen in them?
No,
No.
my next plan.
Right, some have estrogen only, some have proestrogen only, and some have both. Now, how are you gonna teach your patients to prevent, the blood clots?
They think they don't
No
watch
smoking,
them. Yeah, no smoking.
Watch their diet.
Healthy diet. Weight is a huge.
What's something that a lot of females complain about when they're on birth control?
Acne, weight gain. Sorry, guys.
What's something else that's really important about contraceptives to teach your patients?
That they need to take it orally and then, or like, not orally, regularly at the same time, and if not, with antibiotics, don't.
And they don't always
They don't always work, not 100%.
And the only thing that's 100% is abstinence.
What is that?
There's many different kinds of contraceptives. There's pills that everybody knows about. There's rings that, like NuvaRing, that the patient can insert themselves. There's newer IUDs that the physician or nurse practitioner can insert, like the Mirena or the Skyla. The only difference really in the Mirena and the Skyla is the Skyla is made to be worn for 3 years, and the Mirena is made to be worn for 5 years.
Which one's the copper one? Isn't there a copper one?
Neither of those are the copper ones. The copper ones are kind of old school now. They're being used less and less because of the issues that people can have from. What they found is a lot of people will have allergic reactions to the copper. So, and I have seen babies be born with the IUD, like the IUD come out after the baby comes out. So that's still not a full protection either. The IUD. I've seen it happen multiple times. All right, group 4. Most common gynecological cancer that is slow growth.
Uterine cancer. Okay, what is?
All right.
14
So, uterine cancer is very, very slow growing, and unfortunately, it's one of those cancers that usually when it's found, it is diagnosed very late. And usually when it's found, it's usually already like stage 3 or stage 4, and it's already metastasized to other organs. So how would they diagnose uterine cancer? So, what would be a way to treat the uterine cancer? So, there's, different, types of hysterectomies. You can have a total abdominal hysterectomy where the physician goes in and makes the incision, like almost on the bikini line, just like for a C-section, and they take out the uterus. They can take out the uterus and leave the fallopian tubes and the ovaries, or they can take everything out, which would be a total abdominal hysterectomy, salpingo-oophorectomy, which means the salpingo is where they remove the tubes and the oophorectomy is where they remove the ovaries. There's also a lot of the general surgeons now are doing like a laparoscopic assisted vaginal hysterectomy, where they just go in laparoscopically and then they pull everything out through the vagina. So if you don't have the huge surgical scar like you do with the total abdominal hysterectomy, but there still can be complications with the laparoscopic assisted. And that's just one of the newer things that some of the like newer, younger physicians are doing. Some of the older physicians are still only wanting to do the total abdominals just because they're kind of stuck in their ways. Alright, group 2.
They already.
Do they need teachers?
I guess 200.
Alright. Once you get mammograms starting at what age?
Okay, I think it's 40 unless you have a family history, then it's 30, I think, 10 years. So we go with 40. What is 40?
Okay. Anybody else? It's partially correct. You had part of it and then you backed away from it.
Okay. Well, then, yeah.
How many women are diagnosed with breast cancer each
Oh,
year?
I have it. Wait, a lot. Women should be screened with mammography annually beginning at age 40. Annually, is that the part you're looking for?
Yes, at age 40, but if there's a family history of it 10 years prior to diagnosis. So if your mom was diagnosed at age 35, you need to start having mammograms at 25. Does everybody get that? The 10 years prior?
Is that supposed to say 10 years before diagnosis?
Yes. Okay. So 1 in 8 women is diagnosed with breast cancer. I'm sure everybody in this room either has a family member that had it or knows somebody that has it. It's very common, unfortunately, and we're seeing more and more women that are younger being diagnosed with it. One of the big things with the breast cancer is, like, if your mom was diagnosed at age 40, so you're getting your mammograms at 30, you can also have the BRCA testing done, which is a blood test that they use to determine to see if you have a chance of being diagnosed with the breast cancer. And what some people are doing is if they're positive for the BRCA genes, these women are go ahead and having the double mastectomies. And so it's a prophylactic thing, this double mastectomy that they're having, because they have a family history of breast cancer. Maybe their grandmother had it, or their mom had it, or somebody had it, so they're gonna test positive for the BRCA gene. Now, just because if you tested negative for the BRCA gene, doesn't mean you're never gonna get it. So, one of the other big things with breast cancer is they actually just did a study, and they're seeing more and more now that women who are diagnosed with breast cancer under the age of 40 are given the choice to just have, if you're diagnosed with breast cancer in your right breast, to just have the one right breast removed or the double mastectomy. More women are choosing to go ahead and have the double mastectomy now than ever before. So,
That's not guaranteed treatment either.
No.
After.
Is there a
I
certain
didn't-
age that you should do like the blood test? Like, do they recommend?
it's probably just by your, like if your mom had breast cancer at age 50, then you are they're gonna tell you you don't have to start having your mammograms till age 40, but you can go ahead and get tested for the BRCA gene. It is something your insurance will pay for, it's just, it takes a lot to get them to do it. So, I know several people actually, in Jackson County that have tested positive because their mom or their grandma or somebody in their family had it, and they went ahead and had the double mastectomy. But just like you said, just because you have a double mastectomy doesn't, it can still come back. So if there's somebody actually right now that I know who had a double mastectomy a few years ago and hers is now back. And it's just because it can be in different places. So it can be in your breast wall, it can be in your lymph nodes, you know, so. Alright.
We choose 100, thank you.
Alright. So,
Yeah.
dysmenorrhea means what?
Not the same as amenorrhea.
No.
Amenorrhea.
Well, part of the word's the same, so that should help.
Let me go back. So. Painful.
Say that again?
Painful menstruation.
Alright, so, dysmenorrhea is painful menstruation with no identifiable cause. So, guys in here, you're lucky, you don't know what it's like. It's terrible. So how often does your cycle occur? How often? Okay, supposed to occur. 28 days. Now, for some women, if they have a hormone imbalance, it could come sooner, depending on, also what birth control you're on, like Seasonix, you only have a period every 3 months because that's the way the estrogen and the estrogen are made, is so that you won't have a cycle every 28 days, you only have one every 3 months. So depending on that too, can have a play with how often you have your cycle. So somebody mentioned amenorrhea. Is it you, Mackenzie?
Yes.
What is that?
It says absence of menses, but almost any disease that disturbs a woman's metabolism or nutrition can depress ovarian function and cause amenorrhea, which is the absence of menses.
Which is the absence of your cycle. So that can be caused by several different things. Stress is a really big thing, can cause women's cycle to fluctuate, can cause them to miss their period. Another thing is any like women that have lupus, their periods are not going to be very regular unless they're on a birth control or something to help regulate their period. What is another thing you think of when you hear someone missing their period? Menorrhagia is prolonged or excessive bleeding at the time of regular menstrual flow. So, usually, again, it's kind of dependent on the person, but usually a cycle lasts about a week or 5 to 7 days. Some women, depending on their hormones, may have a lot shorter cycle. Some women may tell you they only bleed for 2 days, and some women may bleed really heavy for the full 7 days. So what's something you want to tell women to kind of be mindful of when they are on their period? What'd you say, bro?
Yeah, they've been anemic.
Okay, yes. No, right, okay, so, if you think about it, you're bleeding. You're not sitting there and getting a blood transfusion, so and especially these women that have very heavy periods, they're gonna be anemic, and some women do have to come in and get blood transfusions because they do bleed that much and it is that bad. So, a lot of the times, the provider will, look and see by ultrasound if there's any polyps, if there's any cyst or anything that's causing the excessive bleeding. If it's a younger woman, they're just gonna try to put them on some birth control to, normalize the hormones, so hopefully that bleeding won't be as bad. But if it's a, I don't say older woman, but usually 40 and older, that's not childbearing age, then the physician, or whoever they're seeing is gonna suggest that they have a hysterectomy to help with that bleeding, to get it to stop. I say 40 is not childbearing age, but there's some old people doing some weird things. A couple other things with the female reproductive system real quick. Ovarian cysts are kind of common. You may hear a lot of women say that they have cysts. A lot of times there's nothing that the doctors will do with it. They'll just watch them. Sometimes they'll go away on their own. Sometimes they do have to go in and get them out. A lot of times that can be done laparoscopically. Again, it's a cyst, so it's just filled with fluid. Right. So, a lot of times oral contraceptives can also help the cyst to go away on their own, putting women on oral contraceptives. So, fibroids are tumors of the uterus. They're usually benign, but sometimes the fibroids can cause women a lot of pain, so that's why I'll have to have the hysterectomy as well. They're very painful. Now, I've seen fibroids be, the size of like $50, and I've seen a fibroid literally be as big as like a baby's head. Like, you will look at a woman and think that she's pregnant and it's a fibroid. So they can be all sizes, and just because it's small doesn't mean that it's not causing the woman any kind of pain. So just remember that. Another thing to teach, especially our younger patients who are still having their cycles and maybe using tampons, is toxic shock syndrome. Does everybody know what that is?
Is that like when they leave it in too long?
So it sounds crazy, but I mean, there's been people that come into the ER saying that they have a lot of lower abdominal pain, they just don't feel good, yada yada. So you ask them all these questions and you say, when was you on your period? Oh, I was on it last week, everything was fine, yada. Anyway, you wind up doing like a vaginal exam on it and there's still a tampon in it. And a lot of times people honestly don't know that they've left it in. Toxic shock syndrome. Toxic shock syndrome can kill somebody very quickly. And what it is exotoxins are produced from the bacteria that are gonna eventually spread from just in that one area into your bloodstream. So the patient is going septic. So just think about, what are your normal signs and symptoms of sepsis?
Fever.
What's your heart rate gonna do?
Skyrocket.
And what's your blood pressure gonna do?
Bottom out.
Bottom out. Okay. So what's one of the things you're gonna wanna give patients who may have toxic shock syndrome? Fluids. Yes. Another thing that can happen with women a lot of times, several of these things, like uterine prolapse or the bladder prolapsing, a lot of times it happens more in women who have had multiple births. What happens is the muscles just get weaker and weaker, and they're not able to hold these organs in place like they once were. So they're gonna have to, have surgery to have the bladder held in place, or the uterus that puts, like a sling in is what they call it. Or of course, for the uterine prolapse, if it's such a problem, they're not gonna have any more kids, then you can take out the uterus. One thing you wanna teach women who are older, what is, like if you hear women laughing or something, what's something they say? They pee on themselves, right, okay. So, also that happens, the more babies you have, like I said, the muscles, they get stretched when you're pregnant, and so they do go back down, but unless you're gonna do these exercises, they're not gonna get strong again. So they're called Kegel exercises. And so this is something, this is getting a little bit into maternal child, but you always wanna teach your patients, especially after they have babies, to do these Kegel exercises. And like the older women who may come in saying they're peeing all the time, they're peeing on themselves, they're having to wear a diaper or something like that, you wanna teach them to do these Kegel exercises, cause that's gonna help. And if you have a patient who has like a uterine prolapse or a bladder prolapse, don't freak out. Really, all you do is you just put on sterile gloves and you just push it back up. Because if you don't, the organs can come all the way out. So, but don't freak out if that happens on you. I mean, it will. But make sure, because you are going, into the patient, that you're wearing a sterile glove and not just a clean glove that you get off the wall.
Gotta freak out, walk out the room.
You don't need an order to push their organs back in.
I'm saying, because I had like a patient who had one, but she had the Tichney surgeries, and 2 of them failed. So obviously, I wouldn't do that for her because they failed. Nothing was holding it up. That's why I was asking.
Was it her bladder or her?
It was her bladder and other members. I don't know what it was. I mean, it was
Everybody in there.
I mean, I wasn't asking Steve, I was asking, like, for her case, she'd been dealing with this, so I guess they just, I don't know if they would do anything for her. She had 2 failed surgeries, so that's why I was asking, so.
Alright, what is, female sterilization?
They can't have any babies.
Okay, but how do they do it? Yes, so there's a couple of different ways doctors can do it. Sometimes they snip off the ends, or they can tie them together. Now, because you have this, does this mean you absolutely cannot get pregnant?
No.
I've had a patient before who had her tubes tied, and then a couple years later, she decided she wanted to have kids again. And so then she wound up having in vitro fertilization to have kids again. So, just a little fun fact, Medicaid will not pay for a tubal ligation unless the patient is 21 years old. Doesn't matter how many kids they have, if they're only 19. So, tubal ligation can be done like if the patient has a C-section, it can be done during the C-section. Or it can be done if they have a vaginal delivery, and usually the doctor will wait, like if they deliver today on Wednesday, then they'll take them down to the OR like on Thursday to have the tubal done. It's done laparoscopically. It's a lot easier to have done right after birth, because if you think about it, when you're pregnant, all of these organs are, your uterus has grown multiple times the size of what it was, and so all these organs are sitting up here and they're real easy to get to, versus if you wait a couple years and then decide you wanna have a tubal done. It's still done laparoscopically, but it's a little hard for the doctor to get to everything, because everything's just not right there sitting at you like, hey, I'm right here. So. We talked about uterine cancer. Cervical cancer is predominantly squamous cell. Risk factors for cervical cancer are multiple partners, early age for first sexual encounter, this is also diagnosed via pap smear. Women can also have ovarian cancer, which is cancer of the ovaries. Most are epithelial tumors that grow on the surface of the ovaries, spreads quickly. How many ovaries do women have? 2. So ovarian cancer usually is bilateral. It's not usually just on the left or just on the right. It's usually both. Excessive exposure to estrogen has been known to cause ovarian cancer. It's another cancer that's usually detected late. And women who are diagnosed with ovarian cancer are usually put at an increased risk for breast cancer. Can women take birth control if they're breastfeeding?
Who got the breast milk?
They can take the
They don't have
progestin.
to. Up to 6 months it's supposed to.
It doesn't.
I read that in the pamphlet yesterday. I swear, the women's health clinic I followed, and that's what it said, that if you breastfeed, it's not
It helps.
100%,
No, yeah,
but-
don't count on that. You wonder like how people have kids, like they may have like a 12-month-old and a 1-month-old.
Yeah.
Yeah. Because breastfeeding is not full birth control. So if women are breastfeeding, they can actually take the progesterone-only formula birth control. That is safe. Do you have a question, Tasha?
So you can't take birth control and it won't drop?
Not the progesterone. You don't want to take any with the estrogen in it.
Is that why it's so dry? We didn't get a
Alright, so, we'll talk about abortion real quick and then we'll move to the male reproductive system. So there's 2 types of abortion, spontaneous and elective. A spontaneous abortion is where it's before 20 weeks of gestation, and it's where the body does it all on its own. There's no medical help or anything. So sometimes some women may have habitual abortions, which is just repeated spontaneous abortions for an unknown reason. So a lot of times the doctors will do more tests on the women. They can have what they call an incompetent cervix. There's a couple different things that the physicians can do for this. They can actually sew the cervix shut, which is called a cerclage, to help hopefully hold the fetus within so that the woman won't have miscarriages. After a miscarriage, the women, they can expel all the contents themselves, or sometimes they may need to have a surgical procedure called a D&C to get the rest of the contents out.
So, spontaneous. What was the other one called? Spontaneous?
mother decides that she wants to, abort the baby, there can be, several different reasons for this. Sometimes it's because, if the baby is known to have many malformations or congenital defects. It can also just be because mother's choice, just because she doesn't want to have the baby, she didn't mean to get pregnant. Elective abortions are usually done in more clinics that are not, they're not clean, they're not safe. So a lot of times these women that go and have elective abortions can have a lot of complications afterwards. There's a place, in Pensacola and Tallahassee that will do elective abortions.
Can multiple abortions like lead to like major complications the way you can't have kids anymore? Can't get pregnant? As far as like.
Yes, a lot of the times if a woman is having multiple spontaneous abortions, or even if they have multiple elective abortions, with the spontaneous, the provider wants to find out why this is happening. Is it something with the hormones? Is it the incompetent cervix? And then when you can find out the reason why it's happening, you know, there's gonna be a way to fix it usually. With the elective abortions, it can cause a lot of the scar tissue. Like I said, they're usually not done in safe places, so they're not done effectively either. A lot of times, you have patients that come back in that wind up having to have another surgical procedure because it wasn't done properly, or they're having complications from it. But it can cause a lot of scar tissue that can cause women to be infertile. So. Elective abortions happen more than you think they would. An ectopic pregnancy is where the fetus has planted in one of the fallopian tubes, and they cannot survive. So this can be treated in a couple of different ways. They can have surgery. A lot of times though, with this surgery, you'll have to wind up having to remove that tube and that ovary. Also, there's a medication that women can take. It's actually a chemo drug, methotrexate. And it's just an IM injection. And what it does is it lowers the folic acid level, which will cause a woman to go ahead and miscarry.
So for the ectopic pregnancy, you said that they have to remove the ovary and the tube, so can they not get pregnant after?
Yeah, they can have two tubes and two
Okay,
ovaries.
so just as long as the other one.
Infertility is the inability to achieve pregnancy after 1 year of unprotected intercourse. It can be issues with the man or the woman, so both need to be checked out. There's various different treatments. There's pills they can take. One of them is called Clomid to help women get pregnant. And of course, there's the in vitro fertilization, which is very expensive. All right. Group number 3. Let's move on to male. How do I think again? Let's see.
Male, 200.
Prostate gland enlargement.
Yeah.
BPH.
BPH is gonna be high levels of dihydrotestosterone and testosterone, which may accumulate in the prostate gland and increase cell growth. What's something patients complain of?
Yeah,
And what this is, why they complain about not being able to void is because this prostate gland is enlarging, which is gonna cause obstruction to the bladder. How do you treat this? Flomax is one of the drugs you can use. Yes. Prostatectomy. Yes, to remove the prostate is another way.
Stents. Can you do a stent? This is probably a stupid question, but if it's squeezing around, get the tube, can you put something in there to like hold the tube open? Or they don't do that?
I've never heard of them do that.
Do what?
Like a stent for BPH.
Well,
You mean like a balloon?
I mean, like, they do that with heart. It's like kind of same concept.
You want to patent this or what?
Do what?
Or you want to patent this or what?
It has not
Like,
been
it
done
makes-
before. It makes sense. if
That's
you
what I would
think
think,
about it.
but.
But like, I've
Shades
never
of
heard,
like,
like, me
continuously
and Colby were.
Yeah, we're coming up with that.
Yeah, we're gonna.
Hey, y'all
Look
can
into
make
it.
your
Okay,
own
so,
idea.
here's how we're gonna do this. Y'all look into it and see if there's ever been, if that's ever been done before.
It is.
Okay? And tell us about it next.
Why not? Y'all can
She
make you
needs,
good money.
instead of removing the prostate so the bladder can be unobstructed, to put a stent in place to relieve.
To like hold the walls open.
Pressure.
Where it's squeezing.
We do,
It sounds like
we do, we put staples in the sides and pins it to the sides. I can't remember what
Like that thing.
But not an actual.
Staples, where do you put the staples at? Like on the, like you staple it to what?
whatever's behind it.
Whatever's behind it?
What,
Like prostate? Okay.
Alright, so prostate cancer is one of the slowest growing cancers. Usually metastasizes to the lumbar spine, the pelvis, the sacrum, lungs, liver, and nearby lymph nodes. Usually see prostate cancer more in African Americans, men of old age, it's usually genetic, and men who have a diet high in red meat. Five seconds. Painless lump or mass in one testicle.
Testicular cancer.
So does testicular cancer usually happen in older men or younger men? Younger. common in men ages 15 to 35. Risk factors include an undescended testicle, family history, Caucasian men, and occupational hazards. So just like women need to do self-breath exams monthly, men need to do self-testicular exams monthly. Often this mass is painless. Radiation or chemotherapy can treat it. Often the testicle is removed and they can put a gel-filled prosthesis in. If you have somebody who's really young, has been diagnosed with not only like testicular cancer, but any kind of cancer, who's gonna probably be doing radiation or chemo, what's something that you wanna think about?
Freezing the sperm.
Yes. So a lot of times they will send, men of childbearing age, or even if they're even a little younger, to a sperm bank to freeze their sperm. Because the radiation and the chemotherapy will kill the sperm.
Is that like 100%, you know, after they have that, like there's no way they could get
Not 100%. And it depends on what degree, to what type of chemotherapy are they getting. There's different strengths, how much radiation they're gonna get, where it's at. Alright, infection of the epididymis often caused by bacterial infection.
Raise my hand.
So time
Oh, yeah, that's kind of one of the things.
You're like 15 seconds, yeah.
It's alright.
It says it'll
Right.
This just says information on that. It's on the
part of your answer is in the question.
Epididymitis.
Yes.
Okay, alright.
You were confusing yourself.
Well, I know.
Infection of or inflammation.
So this is often caused by bacterial infection, so a lot of times when, guys are diagnosed with this, they're also gonna wanna check for chlamydia or gonorrhea. So this can be caused by that. Usually they're just on oral antibiotics and something for pain. You wanna tell your patients to elevate their scrotum, use a cold compress, and avoid straining. So no heavy lifting, pushing, pulling, no exercising until this is relieved.
I can't spell surface, I can't spell computer. Let it happen.
It's time for male sterilization.
Is this the
go under general anesthesia or anything to have it done, although they might wish they were.
Does it cost anybody to do that?
For the
Like,
general
if they can ask
anesthesia,
for it?
oh, yeah. Cause then you're gonna have to pay the surgical team and the anesthesiologist.
I got insurance.
Now we rip it off like a Band-Aid.
No.
Okay, so again, is the vasectomy 100% proof that the male cannot get a female pregnant? Usually, after the vasectomy, what the patient will have to do is go to the doctor's office several times and give them their, specimen collection until there's no sperm in it, and then they say that they're clear. But I know people that have still got pregnant.
It's reversible, right?
It's like really painful and like.
I've never had to vasectomy reversible.
Yes.
I've never.
I know a surgeon that had it done, his wife wasn't thinking and just dropped the mail over the couch, and it landed in his lap, and he rolled over, fetal position, crying. It hurts.
You're saying he had just had the procedure done?
He was 3 days post-op.
Okay,
You
okay.
don't know what pain is. I don't hear it.
And she checked the mail come in, she goes, here you go, and just
You
dropped
haven't seen those things like where you ask a question and
Oh,
it's
really?
Now, why do you
No.
I thought somebody
You
would
get
do
it.
it. Is this us? The babies?
Yes.
Oh, gosh.
All right, the baby is born with hypospadias, and the parents are asking the nurse about a circumcision. What would her best
What
response?
is hypospadias?
I'm looking for it.
They have their policy.
Somebody has their power. Yeah. Is it not in our book? No, I said not get rid of it.
Okay. Can't find it in your PowerPoint?
Yeah, but it doesn't say to or not to do.
Okay. So, what is a hypospadias?
Openings on the side.
Openings on the underside of the penis.
Okay.
The underside of the penis.
So,
Okay,
normally you have the urethral opening right here at the tip. So the hypospadias is gonna be where the opening is underneath. You can also have the epispadias where the opening is on the top. So, what is a circumcision? Where the doctor goes and removes the foreskin. So if you have your urethral opening down here, are you gonna remove that foreskin? No.
So don't.
No. So a lot of times with, the hypospadias and the epispadias is congenital, the babies are born with it. Something you're gonna immediately look for when the baby's born. A lot of times it's genetic as well, so maybe the dad had it, or granddad, or somebody in the family has had it. So what they're gonna do is they're gonna be sent to like a pediatric urologist. Usually the biggest thing is making sure that the baby can pee. Most of the time, I've never had one born with a hypospadias or epispadias that could not go to the bathroom. So as long as they're going to the bathroom, it means things can wait. If they're not, then they're gonna need to be, shipped somewhere and be seen immediately. But what they're gonna do is that urologist is then gonna look and see, which one is it, the hypo or the epispadias. and then he'll determine, so usually later in life, probably when the kid's 5, 6 years old, they can have the circumcision, but it's not something that can be done immediately, cause the hypospadias or the epispadias has to be corrected and healed first. What is what's a big risk with circumcisions? Bleeding. So if you have a man that comes into your ER and says that he has a persistent erection, what do you want to ask him? And what medication can you not take?